Hi everybody, I'm Stephanie. I'm with 9 Health, and May is Mental Health Awareness Month, so we are starting a new series on Fridays in May. We're going to be covering different mental health topics and talking about the mental health resources available to people in Colorado, across our state, for mental health and for substance abuse. And today I'm with Kelly Groen. Is that how I say your last name? I didn't even ask you very good. With Spark the Change. She's the director of the Pro Bono Mental Health Program with Spark the Change. And I am also with Allie Kyrelli. See, they're kind of hard last names, but I did it.
Yes.
And she is a peer support and resource directory specialist with Rocky Mountain Crisis Partners. So we're going to kind of talk about what each of their organizations do and the resources that they provide or help connect you with. And if you have any questions while we're all chatting and talking here, please ask. And Kat, who's behind the camera, will let us know what your questions are, and we will get them answered. So first, Kelly, just give us an overview of what Spark the Change does and how you guys help people.
Okay, great. So Spark the Change Colorado is formerly known as Metro Volunteers. We just had a name change in August of last year. So we have a mission to inspire a movement of good and enable change makers through using volunteerism as a strategy for that. So using volunteers to help to meet community needs.
Very much like 9 Health Fair. We rely on our volunteers, so it's a volunteer-based
Absolutely.
It's awesome.
And so we work with anything from, a one-time shot where somebody's volunteering for a one-time project all the way up to very highly skilled volunteering, such as the Pro Bono Mental Health Program, which I can talk about a little bit more detail. Would this be a good time to do
Yes,
that?
of course. Give us
Okay.
the whole rundown of what you do.
Okay, sounds good. So our Pro Bono Mental Health Program, we're currently operating statewide, was part of the impetus actually for our name change because we're no longer Metro Volunteers, but operating also in communities in Pueblo, bridging the gap between Denver, Colorado Springs, and then also north and west to Longmont and Boulder County.
Okay.
So we utilize volunteers who are licensed and insured therapists to meet the needs of uninsured or low-income Coloradans with barriers to accessing mental health care.
Okay.
So volunteers open up their private practices for folks. We have an incoming support line where we refer people to those volunteers.
Is that support line what someone would call? Like if someone's watching right now and they have a family member themselves and they want some help, they call
and I
that
actually have a phone number here.
We can do
either now or later.
Yes, let's show people that phone number. So these are just some printed materials from Spark the Change Colorado. 1-844-380-6355. I just read that upside down, so hopefully that was correct.
Yes.
That's for more information, and then there was a hotline too, or is it either of those numbers?
That's a perfect number for any inquiry.
Great. So yeah, if you have someone in your family or you yourself need help connecting to some resources, you guys are able to help.
Absolutely.
All right, tell us a little more about.
Yeah, so our volunteers open up their private practices. They also work in conjunction with what we call host sites.
Okay.
Those host sites are organizations that are already serving folks with mental health needs in the community, and we place volunteers at those host sites to help them expand their capacity to serve those folks. Okay. So those are kind of the two models that we work in. We also have volunteers who are supervisors for postgraduate license-seeking candidates, so that they can get the hours toward their licensure. We can offer that supervision from our volunteers. So, so we operate. We're trying to expand more statewide into rural southern Colorado already, and that's in progress too. So
That's great.
Yeah.
And then, Allie, talk about Rocky Mountain Crisis Partners. You guys describe yourselves as in-the-moment crisis care for those looking for treatment for mental health, substance abuse issues. So just give us a little information about what your organization does.
Yeah, so we are the statewide crisis and support line. There are two sides to our line. If somebody is experiencing a mental health or substance use related crisis, or a loved one of theirs is also experiencing something like that, they can call our number. We are 24/7 on our crisis line. We also answer other mental health crisis lines, as well as the suicide prevention lifeline for any Colorado area code.
Okay. Do you have those numbers? I'll post them in the comments later, but if you could just say them.
Yeah, so it's all one number. You'll go to 1-844-493-8255. And then it'll give you an option to select either crisis or the support line. So crisis, like I said, is 24/7. We're staffed by crisis intervention trained clinicians and triage specialists. They are there to support in the moment crisis, whether that is someone thinking of suicide, whether that is someone experiencing behavioral health, panic attacks or something like that. They are there to help them through it. We also have the support side of the line, which are staff like myself and my peers. We are peer support specialists. So what we do is use our lived experience with mental health or substance use issues and conditions. We identify as individuals in recovery of those things, and our job is to, in the moment, provide support, resources, skill building, and problem solving to whoever calls in. So again, loved ones or individuals, we answer for both.
Okay.
We also have a text line for our crisis services.
Which can be nice if someone's not wanting to
Yeah,
talk or.
exactly. Sometimes we find people don't really want to talk, but it's easier for them to text. So they text the word talk to 38255.
Okay.
It's just those last 5 digits.
Okay.
And again, they'll be interacting with the clinician. And then lastly, we also have a chat feature on our
Through your website?
Yeah,
Okay.
exactly. Which is just rmcrisispartners.org.
Okay.
So lots of different ways to access our services, and we serve the entire state. So
Great. And
we're there.
do these organizations kind of work together, both of you? So do you
Yeah,
have volunteers that
absolutely.
work with Spark the Change Colorado? How's that work, the two of you together?
Well, ironically, Rocky Mountain Crisis Partners used to oversee the pro bono program,
Okay.
and so there was a switch in
Okay.
in the oversight of the program, and so we
Right.
work very closely together.
Great.
And I know when we first started the program at Spark the Change, we consulted with your organization to just do a giant brain dump, really, about what's worked well,
Right.
and so we do have a lot of.
I think you reach out to each other for resource help, maybe.
Absolutely.
Yeah,
Yes.
the pro bono counseling program is in our directory still, and even though we may not be taking those calls, we know of its existence and can share between the callers and who accesses the service.
And likewise, we use your resource directory all the time because we get lots of calls that aren't maybe necessarily appropriate for our program.
Okay.
Since we are not a crisis program, we
Okay.
will refer to you guys very often. There's a lot
Okay.
of back and forth there.
Okay, yeah, that makes sense. And you guys can both touch on this, but I've had family members with mental health issues that have tried to find help, or we've tried to find them help, and resources are kind of hard to come across in Colorado sometimes, or it's just hard to get into the system. Sometimes cost can be a barrier. You can both kind of talk about this, but just talk about how essential you are to Coloradans just by providing a link to some resources and being a resource yourself.
Absolutely.
So as I was saying a little bit before we started, one of the biggest things is cost, like you said, cost barriers. I think the statistic was 40% of Coloradans say that is a barrier to accessing care.
It's probably
so-
all care, but even more so mental health care.
Right, exactly. You have insurance limitations
Right.
of what they will cover and things of that nature. So having something like a pro bono counseling program, or just a line that someone can access further resources that may not be within their insurance, is very helpful, I feel, for Coloradans to start that process. Another barrier, I think, is also stigma and discrimination.
Right.
I think there was a statistic about almost 25% of Coloradans identify that as another barrier, where they just won't go get treatment because of that fear.
Right.
So creating a safe space, at least for our line, what we do, and I'm sure with you guys too, is creating a space to receive non-judgmental support while looking for resources.
Yeah, we've talked about before, even just at Nine Health, and we have one question, so I'll do that in 1 second. I was just saying at Nine Health Fair, we've talked about, it'd be nice if some point we get to the point of talking about mental health issues, like I have diabetes, you say I have
Right.
schizophrenia, I have some mental health issue that's going
Absolutely.
on, and it's kind of just a conversation, and then you're able to get that help you need. hopefully
Absolutely.
easier. Okay, what is our question?
Are there any scholarships or programs for young adults battling mental health after high school?
That's a great question. Scholarships. The question was scholarships or programs.
Programs, yes.
Yeah. I can't really speak to the scholarship piece, but I know that our program, we have a pretty wide variety of expertise within our volunteers. That's the beauty of working with our volunteers, is that they all bring, a little bit of a different niche to the program, and so we certainly have some counselors who are open to working with teens and adolescents, and certainly that could be an option. I don't know if you have anything else to add.
I mean, the resources that I'm aware of, honestly, for young adults specifically, peer support is a great space to enter the mental health field, because there are less barriers to really interacting. Whereas licensure and things like that might be barriers, whether that's cost or age or experience. So I would say looking into peer support organizations such as ours, Colorado Mental Wellness Network is another good one. So spaces like that might be a good place to start.
And that's if you're like wanting to be the person that is helping others, right?
Yes.
Right.
So
Yeah,
yeah,
I
is
think
that
I've
I'm not sure if that
misunderstood
question. Yeah, I'm not sure if that question is
Okay.
about.
I figured you took one.
Yeah,
There you go.
So we kind of cover both. So that question could be about seeking help or
Yeah.
Yeah.
wanting to provide help too.
Absolutely.
So yeah, that was kind of
Yeah.
Yeah.
Offensive.
But yeah, let's get your thoughts
Yeah.
too, though, as well. Just
Sure.
on the lack of resources sometimes for mental health or
Yeah, absolutely.
the challenge, I guess, for getting help.
Yeah. And I would mirror what you've said, you know, in terms of we see a lot of the similar barriers. It's financial, it's stigma, it's sometimes you have insurance, but there's a 4-month waiting list to get in to see somebody and you really want to speak to somebody
Yeah.
now. That's something we really try to make a priority in our program is to really address it when it's happening, when somebody needs it, because we don't want it to escalate into a crisis. And oftentimes somebody who, you know, we see a lot of people dealing with depression or anxiety, and if we can, you know, connect them with a counselor for 8 to 10 sessions, oftentimes it prevents it from escalating into a crisis. So
Right. Yeah, that was
that's
kind of
really
my next question too.
So-
is I feel like that's part of the insurance challenge. Is
Mhm.
a lot of insurance companies might not cover anything until it has escalated into a crisis or some kind of
Right.
physical harm has been done.
Yeah.
And that's kind of it needs to change at some point
Absolutely.
with
Yeah.
that
Yeah.
for things to change. So it's good to have some resources like this that are pro bono. You know, people can come to you and just seek that help that they need.
Absolutely.
And then I do want to talk about, you were talking about running on volunteers, so tell us a little bit about what volunteers get to do. You kind of touched on it a little bit,
Sure.
but you know, it ranges from therapists to all kinds of positions, I'm sure, and what you kind of need.
Sure,
if you need more
absolutely.
volunteers.
So our capacity is really as large as our volunteer, you know, as many volunteers we have, we could expand our capacity
Good.
tremendously. So, and again, I think I said this, but the beauty of working with volunteers is that they each bring such unique skills so that if we have a volunteer who really has a specialty, we can approach a certain host site or a new audience to say, we have this resource and help us engage in a partnership to utilize this resource. So really, we're looking for volunteers in all aspects of mental health. We do ask that they are licensed and insured.
Okay.
And we have, the one exception to that is people who are seeking licensure, looking for hours.
Do they need to have
towards
like a
their
preceptor
supervision.
with them? Is
So
that, or you guys
it's a
provide that?
supervisor that
Okay.
they can either come with if they have one already, or we can try to help them, you know, connect them with the supervisor
Okay.
as well. So, yeah, that's really what we're looking for. For the pro bono mental health piece, our organization as a whole, we live in that volunteer connection world, so we have on our website all sorts of volunteer opportunities, no matter what your, you know, for various skill levels and interests and locations. So our website is a matching database as well. So volunteers all across the board can go there and sign up and connect with other organizations too. But specifically for pro bono, we're really looking for those professionals who are licensed.
And I know you said you've expanded to other parts of the state. Is there
Yeah.
future plans to expand farther?
Well, we're looking right now into rural Colorado, kind of exploring some options with telehealth and trying to get a little bit creative since some
Right,
of the
yeah, that'd be
practitioners
great.
aren't always actually in the communities.
Yeah,
that we're
to
seeking
talk about what
to serve.
telehealth means. for
So,
someone
sorry,
like
yeah,
that.
telehealth is the use of technology to connect remotely. So maybe I'm here in Denver and I'm a therapist and I'm looking at somebody in rural southern Colorado, for example. Rather than driving there or having to physically be there, we would do the connection via like a technology that would connect us via video call, phone call, that kind of thing. So,
Okay.
yeah.
And then we can ask you both this, but maybe Allie, you kind of just touch on this. And since it's Mental Health Awareness Month, let's just talk in general about some mental health conditions that are common, that people deal with, that
Yeah.
you know maybe they need to recognize in themselves or others to seek help.
Yeah, because we receive such a wide variety of calls throughout the state of different people, we see trauma. And that doesn't necessarily mean someone reporting that they have a diagnosis of PTSD or anything like that. Just what they have gone through in their life, things that have happened to them. So we focus on providing and advocating for trauma-informed care, which is essentially operating under the, I guess assumption would be the word that, you know, what has happened to you, you know, you're approaching this situation of seeking help with a backpack, as one of my colleagues says, full of what you have been through already, and that can be societal traumas, whether that's poverty, homelessness, racism and other societal traumas, or personal traumas in childhood or interpersonal. It could even be mental health trauma with hospitalizations and things like that. So we really take the approach of educating loved ones about trauma-informed care, and also practicing very strongly in our peer values that trauma-informed care as well. People calling in crisis are bringing more than the crisis to the table. Something has brought them there. So we want to be curious about their experience, and to kind of touch on how other people can maybe look for that. Just really asking and creating safe spaces to share stories, which is part of what our line is too. Sharing what has brought you to where you are, and what do you find that you need most help with, and how can we provide that? So curiosity while demonstrating understanding, and again, creating that safe space to just be there with that person and everything that they're bringing to you.
Yeah, because it can be hard as a family member to be patient with someone who's going through something,
Right.
or not understanding it yourself,
Exactly.
or experiencing it yourself. So,
Yeah.
so even family members can call the line too for others,
Yes.
and can call you guys as well.
Yeah.
And do we have any other questions on Facebook? Or
Yep, just one more. Mental health, where can they find more resources? So if you guys can give your website or...
Yeah, so let's just go over that again.
Yeah.
Again, we're with Spark the Change Colorado and Rocky Mountain Crisis Partners. Just tell us kind of again how people can reach you and reach out to you guys.
Sure.
SparkTheChangeColorado.org is probably the best resource for reaching the pro bono mental health program. I know it's long, but SparkTheChangeColorado.org.
And we can show these are some resources from Spark the Change that they brought. They have a couple phone numbers on here, and their website is listed kind of in these email addresses too. But
Our number's on there too.
oh, is it? Where is
Yep,
it? Oh,
right
no,
there.
so there we go. That was the other number I was looking
Yes.
at earlier. So that's, yes. Those are the two numbers that would be good to reach out to you guys. And what was your website?
Our website is rmcrisispartners.org. That's where you can access our chat feature. You can also access our resource directory, our resource library, and then that number, just to say it for people, is
Yeah.
1-844-493-8255. And then lastly, for the text line, you'll text the word TALK to 38255.
Yeah, sometimes that's much easier. A lot of us
Yeah.
like to text, so that's
Yeah.
probably a good way to
It's
reach
a
out.
nice way to
Is there anything else? Is there another question?
Just a comment. Gianna said, thank you for doing what you're doing.
Thank you,
very
Larry.
much.
And we are just trying to bring, the whole month of May, just bring some awareness to the mental health issues affecting Coloradans and the resources that are available in our state. If you have any additional questions, you can post those in the comments, and I'll get them answered for you by Allie or Kelly. But is there anything else that you guys want to add before we kind of sign off here? And any other things that you wanted to say?
I think you can add to this, but I think it's important to remember that you don't have to reach that critical stage of something is going to happen.
Yeah, I
that
think
we
people
don't
do
want to
struggle
happen.
with, well, am I
Yeah.
going through something? Am I not going through
Right.
something? So even if you don't know, you can give these
Exactly.
you can give these ladies' organizations a call and
Yeah,
help
totally.
you through whatever. Because it's probably a lot better to get help, sooner rather than later. You don't
Yeah.
want to reach a crisis point. So.
Right. And if you do, we're also here.
Right. You guys are here to help. That is great. All right. Well, thank you so much for joining us. We good? On Fridays in May, we'll be covering different health topics and going over resources. So tune in at 1 o'clock on Fridays, and we will sign off from here. Thanks for joining us.